Hi, everyone. Good morning. This is Kerry Mahoney from the ARC of Massachusetts. Thanks for joining us today. For problem solving and support and resources, I'm going to be talking about meeting basic needs. What you can receive from your community, what's available, state agencies, the government, all sorts of things. So I wanted to welcome you all. And just to make sure you can hear me and see my screen okay, can you chat in to me? I have muted you all upon entry. We will
Hello
save.
there.
Hi. We
Deborah
will save.
Stevens.
Okay, good. We will save our questions to the end. So, and we might be expecting a special guest today. I don't see her on yet, but I'll just begin with the presentation, and if she joins us, we can just have her come in. So, anyways, this virus has impacted us so much, not only in terms of our day-to-day lives, but also our ability to make ends meet. So anyways, I will go to the next slide. And it seems like our audio is working great, so that's good. All right. Okay. So how many people are unemployed in Massachusetts? You can see my typo there, where I said exclamation point, 40,000 have applied for unemployment. It should be 140,000 people have applied for unemployment. I guess I was a little taken back with that number, so that must have been a little slip what I did by putting in the exclamation point. So tons of people affected. I read from United Way that 2 out of 5 families cannot afford the drop in income to meet their basic needs. Women are being more affected than men. People who can work at home are not nearly as impacted. Caregivers for children and people with disabilities, they are definitely affected. They are not able to leave their homes because they're now caregivers 24/7. And also very highly affected are those people working in the restaurant, travel, hotel industries. So the impact of this COVID-19 is actually greater than, after 3 weeks, it's greater than the recession. So that was pretty devastating to me. So what can we do about it? There are things that are available through the state, through the federal government. People are working very, very hard to make sure that people can make ends meet and that sort of thing. The biggest thing is obviously unemployment. They've made it pretty easy, and through mass.gov. And you can just click on the link to apply online. It's available in 7 different languages, including Haitian, Creole, Chinese, Spanish, and a variety of others. So that's just something to definitely take advantage of. So the CARES Act, which was one of the stimulus packages in the federal government that they passed, also provided Massachusetts, along with other states, additional funding to meet that demand and small business loans. So I know several agencies that support people with disabilities have started to apply for the small business loans and have been getting approved. So there's also a private fund which is available for workers who have who were laid off, have low wages, or caring for families. It's called the Massachusetts COVID-19 Relief Fund, and you can click on that link. And it was, I just saw it on Governor Baker's update about a week ago, and First Lady Lauren Baker and Eastern Bank and a number of others have been doing fundraising privately to develop this relief fund. So Eastern Bank is the bank that is allocating these funds. And so you can, if you click on that link, you'll be able to bring it right there. Also, United Way in Massachusetts, they are providing assistance for families, again, who are struggling with making ends meet. That's the link to be able to click on and how to apply and who's eligible, that sort of thing. And you also can see that there's other communities who are also doing additional resources within their United Way organizations. So one's being the City of Lynn, one is in Newton, and I can't recall the other one. So, but it's all on that website. So there's an additional communities who are providing support and services. And also, of course, our federal stimulus checks, should be coming. I'm not sure if anybody has received one yet, but those, we have lots of information on the ARC of Massachusetts website about who's eligible, how much you get. If you are on SSI, how do you get connected, as well as if certain circumstances where if you hadn't ever filed taxes, there is information on that as well. So if you go to our website, and you should be able to find all that information. So go on to the next slide. So other state resources, these are for people that, they've always been available for people who need assistance, Department of Transitional Assistance, women, infants, and children, for children under 5 years old, known as WIC, SNAP, which is formerly food stamps, and also just housing. There's been a lot of details about what's going on with housing. For food assistance, there are these COVID-19 resources. I put all the links in there. See if you're eligible, and see if it's something that can help you during these difficult times. Also, there's been a lot with housing going on, and so there's a whole page on the mass.gov info about what kind of protections people have right now for their housing. They have ordered that no people can be terminated for any kind of subsidized housing at this time, such as a Section 8. They have also asked landlords not to evict people during this time. There's more advocacy that is going on and more protection. There's also information if you're having trouble making your mortgage payments or your rental payments. There's information on there and ways to try and get some assistance. So I urge you to move on to that. And let's see. Okay. Also, we have some other resources here. So, for families, for people with disabilities and their families. Oh, I apologize. I misspelled families. The Department of Developmental Services, they provide all sorts of support for people with intellectual and developmental disabilities, including autism, the family support centers. I know many of the centers are going out and buying groceries, delivering sometimes needed PPE or personal protective equipment to people. Some agencies are providing a worker to go into the home because I heard of a family who's going through chemotherapy. And so they are the Family Support Center is sending a direct support professional to go in while that mom can go through her chemotherapy treatments. Day programs, they're doing far more about online virtual programs. I've also heard of different places helping with food and that sort of thing. And then the service coordinator at the Department of Developmental Services, they're available to talk with you about what your needs are, try to help you navigate as well as the Family Support Center. So I urge you to all connect with your Family Support Center. They are really the first stop in terms of getting what you need and where to get it. There's also, for people who don't have DDS services, there is independent living centers. There's a link to all of the different centers throughout the state of Massachusetts. They also provide personal navigation for where to find resources, and different types of financial assistance. They're a great advocacy agency for people with disabilities. So if you're not linked up with Department of Developmental Services, I'd recommend checking them out. Then also there's the Aging Resource and Disability Centers. They're affectionately called ADRCs, and they are a consortium, kind of like that first stop to a place where to call, especially if you are an older caregiver. It's good to know that some of our older caregivers are eligible for some services on their own. So perhaps Meals on Wheels, other type of family caregiver assistance can be available. And these services can be combined with services that you're receiving through the Department of Developmental Services. So you don't have to choose one or the other. But if you are a caregiver and you are over the age of 60, I definitely would check out the Aging Resource and Disability Center in your area. And so this link will bring you to all of the ADRCs throughout Massachusetts, and most of them are at elder or senior service agencies. And I would just give them a call, see what they're providing. They also have a family caregiver program, which is specifically for caregivers who are caring for people with disabilities of any age in their homes. So those are some resources that I wanted to share with you. And then the other resource is, hold on a sec. Oh. All right, it's in your communities. So this is the website of the community. I just thought I'd check out Waltham, Massachusetts. That's where our office is. So they have an amazing amount of information on their website. So you can, if you need, they have their own resource guide for people of Waltham. They have a help request form for housing, for food, for utilities, other basic needs. It's also in Spanish. The Waltham Public Schools resource pages for meals for students, online extended learning, support. So many school systems are also providing Chromebooks to their students so that they can participate in the virtual and online learning that's going on. Applying for unemployment benefits, free food resources. Many communities have their own food banks, free grocery options, information regarding real estate taxes, small business open, rental assistance, COVID-19 information and guidance in other languages. The Waltham Public Library is offering online resources. And also really important is, the mental health and coping during COVID-19. This is a really stressful time for people. People who have anxiety, depression, just people who are isolated. You're people who are caregivers right now, you're really doing, 24/7, and it's physically and mentally exhausted. So don't be afraid to reach out to and get some information on how to make it through life day by day a little bit easier. There's also volunteer opportunities. I know in my community, I'm a volunteer, and I help other people who can't get out of the house, can't go grocery shopping, need assistance with errands or whatever to pick up their medications at the pharmacy. So these are things that are available in most communities, and typically these are they're all on social media as well. There's also another website, a free online tool called Buoy Health, and I've heard about this before. But you put in your symptoms, and it will bring you to kind of knowing what to do, next steps. So I'm just bringing that up right now. So and it's sometimes reassuring to people that they're, because of this little checklist they did, they may not be as at risk as they thought they might be. So from there, sorry, I lost my PowerPoint. I'm just going to try to get it back here. All right, here we go. Okay, and then also in a lot of the grocery stores, they are having senior hours. Typically, they're pretty early in the morning. I have been kind of impressed with some of the grocery stores. If you have to go out, they're doing a good job in terms of sanitizing carts before they're giving them to you. They're making their aisles in the supermarkets one way, so that you don't have to be as close to others when you're shopping. And some of these new and structured shopping instructions are helping others that so you're not as close. But it also really comes down to a lot of just using your practical sense, following the Center for Disease Control guidelines, hand washing, sanitizing, wearing masks out in public, limiting your ability, the number of times you go out, and that sort of thing. So that's what I had for today. I just wanted to bring you to our calendar for the week. Yesterday, Leo actually interviewed one of our executive directors, Anne-Marie Barja from the Charles River Center, and she spoke about what residential programs are doing to keep people safe and to limit the number of people that may contract COVID-19. Tomorrow, Maura Sullivan will be speaking about state updates. As you know, things are going fast and furious, and so she'll be talking about what's happening to date in Massachusetts. And then on Friday, Ellen Taverna, our policy officer, is going to be talking about what's going on in the federal government. There's a lot that's happening federally. They're trying to get another stimulus package passed, and we want to make sure that people with disabilities are well represented in that, as well as our direct support providers are being fairly compensated, and also that there is enough equipment for people. Anne-Marie was sharing yesterday just the amount of personal and protective equipment, PPE, places are going through. So just every time you work with a person who may have any kind of secretions, so person with a physical disability or even people with intellectual disability, you have to change your gown, you have to change your gloves, and you have to change your mask. So as you can imagine, in group living situations, how many change of PPE you have to do on your shift. The same with families. They have nurses coming into their homes. They have possibly a personal care attendant. They have, possibly a person helping out in their families. And again, it's important that we have this assistance. So I just wanted to also share with you a little bit about the ARC of Massachusetts. I'm sure many of you are aware, but we're the The ARC is the largest disability organization advocating for people with intellectual and developmental disabilities and their families in the country. We're part of the national brand in Massachusetts. We're the state affiliate, and then we work with 17 other affiliates. You may know more of our affiliates as service providers. The ARC of Massachusetts, our mission is to provide outreach, education, and advocacy in terms of policy, in terms of helping to make sure that people with disabilities and their families have good lives. And then our next slide is just a little bit about, we do rely on donations, and we're hoping that this information is helpful and you'll consider donating to the ARC of Massachusetts. So let's, that's our website, arcmass.org. There's a donate, you can /donate. If you want to know more about COVID-19, all you do is go ArcMass /COVID-19. So there's plenty of information on these, and we update this daily, most days. So stay in tune with us. So now I'd like to open it up to questions. I hope this was helpful. Let's see. I saw Charlie Fisk. You had a question.
No, I did. Can you hear me?
I can hear you. Yeah. Yeah.
I've got lots of questions, but didn't want to have one right now. Thanks, Kerry.
Oh, okay. All right. I saw your hand raised, so I thought you wanted to have a question.
I just
okay. I'm gonna lower your hand. Okay. All right. How about anybody else? Anybody else have a question? Here, I'm going to check the chat box. All right. Okay. Oh, okay. Kate Ryan. Thank you, Kate. She reminded me that tomorrow's Wednesday, not Thursday. So I don't know about all of you. Sometimes I get a little mixed up on what date is what.
Hi.
Okay,
this is Deborah Stevens.
Hi, Deborah.
Hi. And I saw that Christine Hubbard had a question about Rogers guardianships, Rogers orders.
Yes.
I happen to be an attorney who accepts CPCS cases and does Rogers coverage, and not in Middlesex, but basically there was a standing order from the probate court, and each court is doing something somewhat a little bit different as to how they're doing interim orders, but kind of generally things are being continued for 60 days. She should contact very specifically the Rogers attorney for the person involved. They should know. Okay.
Okay. Thank you.
If they have any other questions,
no, I appreciate that.
You're very welcome. But there's
okay.
a standing order. It's on the probate court website, deals with Rogers. And then there may be some other things on the probate court website under the trial court. All of the standing orders are there, and there are specific things for specific courts, and you can find very specific information there.
Okay, great.
Okay.
Thank you.
You're
Is
welcome.
everybody familiar with what a Rogers guardianship is? Would you like to explain that to folks?
So a person who is under guardianship in this state cannot be prescribed antipsychotic medication without court approval. So it just applies for people who are under guardianship, and that guardianship is determined that they're not able to give informed consent, and it's called substituted judgment, and the person would be assigned counsel, and the court every year issues an order allowing that medication to be administered for another year. So every year these orders come up for renewal, and right now people cannot get to see their doctors, they cannot get to see their clients to do these renewals. The renewal process pretty much starts about 60 days ahead of time of the expiration of the order. Each court does it a little bit differently, but pretty much works that way.
Okay, thank you. I appreciate it.
You're welcome.
All right, well, we'll go on to another couple of questions. Okay. All right. This, let's see, from Linda. She's from our Family Support Centers. Linda, would you like to share a little bit about what you folks are doing in the Family Support Centers? You can unmute yourself and just tell us a little bit more. She works for LifeLink's class, and you support the families, I believe, that are medically complex, and also families that are in your more intensive programs. So would you like to just do that, or did you log off? You might have logged off. Okay. Robin has a question. What's the topic next week? And the topic next week will be, for my session, we'll be talking about anxiety and depression and how to make sure our mental health is in check as we go through these really, really difficult times. So people who already have, mental health conditions such as depression and anxiety, how do we help keep people in check? But also people, who are facing this pandemic and, developing issues. So Kate is asking, what resources explaining COVID stuff, specifically for adults with learning disabilities, not for kids, but for adults who can handle adult topics? Well, I think, Kate, the CDC has some good, Center for Disease Control has some good basic information. There's also a good handout I have seen on COVID-19 that was developed actually in Vermont by a group of self-advocates. That is on our website at thearcofmass.org, and you can find that on our website. It's a pretty thorough explanation. I was also thinking that it would be good if you think people would be interested if we had a nurse on our session, and they could possibly answer a little bit more questions medically around COVID-19. So that's another topic that I'm exploring. We want to meet your needs. So if you have ideas, topics that are helpful, please just let me know. I am available at Mahoney, MAHONEY.org, at arcmass.org. And just chat in what you'd like to hear. So anyways, I'm looking at the time, and I want to be respectful to you. So thank you, everyone who joined us today. We are going to be rerouted automatically to a brief 10-question survey, and if you could fill that out, it's really helpful to help us plan these webinars, making sure that they're meeting your needs, and also suggesting topics that we're doing. So I hope everybody stays well, and you all have a great day.
Thank you, Kerry.
Take care.
Thank you.
Bye-bye.